Welcome back to the third year of medical school lecture series. Now today we're going to discuss how to prepare to see a new patient. Admitting patients is the core of what physicians and doctors do. So you need to develop a mental and a strategic framework to ensure that every new patient that you see, you perform a thorough evaluation of them and take excellent care of the patients. The better you are able to prepare to see a patient, the better you're able to then care for the patient. And then you'll be better able to present those patients to your attendings. So preparing to see patients is vital to doing everything else well. So let's discuss preparing to see a patient. Now let's say you're on the internal medicine rotation during your third year of medical school. You're already an engaged and excited member of the team. Since you already have the contact information of the residents on your team, let's say you get a text from your senior resident or the intern saying, hey, we have a new patient in the emergency room. He is here for abdominal pain. What do you do next? Well, you should text back your resident, okay, let them know that you got the text, but the first thing you want to do is ask yourself a few questions. You need to text back and say, hey, what do you want me to do? Do you need me to come to the emergency department immediately because the residents are already there or they're going there now? Or is it a patient you guys can see in 15, 20 minutes and you have time to review the patient's chart on the computer or in the file before going down? So that'll give you a sense of time acuity. Is it I gotta move now, or do I have some time to prep and review? Then, when you get the text, you need to get a few pieces of information from the resident that are really vital to your preparation. Even if you have to go down immediately, mentally preparing, you do need these few pieces of information. The age of the patient. What's their age? Because problems for pediatrics or young people is very going to be different for problems for older people. So if abdominal pain in a kid is different than abdominal pain in an older patient. So age is the first thing you want to ask. What is their sex? Are they male or female? Anatomy is different. Someone has abdominal pain, your differential is different if you're talking about a guy or a girl. And what's the chief complaint? In this case, it was abdominal pain. So just ask them, hey, how old are they? Is it a guy or girl? And why are they here? Those three pieces of information you absolutely need. So let's go through both of the scenarios of you preparing to see a patient with limited time and you preparing to see a patient with adequate time. So let's go through first the limited time scenario. If you have to go see a patient immediately in the ED, then you get that text, you get those few pieces of information, you start walking. What I want you to do is pull out the smartphone in your pocket or the pocket book reference that you have and start looking up the differential diagnosis for the chief complaint of that patient. If you're good enough, from the differential in your mind, try to form it. Don't just rely on the book. So they say, okay, the patient's here for abdominal pain. What could it be? If it's a guy, your differential is going to be a little bit different than if it's a girl. Try to come up with it first. Say, you know what? Could it be an ovarian cyst? Could it be ischemic bowel? Could it be appendicitis? Could it be gallbladder? Start to kind of think of the differential. And then look at your smartphone and see what the differential is or in your pocket reference. This is really a good learning exercise. But if you're super going to the ED quick, you may not have time for this exercise, so use your judgment. If you need to move quick, pull out, start looking at the differential, start getting the basis of your thinking going. And this is really what our doctor's minds needs to do. Whenever the patient has a problem, you need to start thinking of a differential. You need to come up essentially with a list of possibilities as to why the patient has the concern they have. This list of possibilities is what we call the differential diagnosis. So you get the text like, it's abdominal pain in a 23-year-old female. Okay, that's a very unique differential. You start looking that up in your phone, you get some ideas going as you're walking down to the ED, or the emergency department as we call it. So say you're in the emergency room, that's when you'll see the patient, you'll talk with them, you'll gather information, you'll do a history and you'll do a physical, and you'll narrow your differential diagnosis in that process. That's the art of doctoring essentially. And then while you're seeing the patient, you'll usually be doing it with the resident as a third-year student. And the resident's going to ask you, what do you think? Third-year student, what do you think's going on? Why is the patient here? You heard all this information. We told you the problem. What do you think's going on? Well, if you looked up the differential diagnosis beforehand, you kind of focused your train of thoughts in your mind. And then when they ask you what do you think's going on, you can say, you know what, here's what I think the differential is for the problem. And based on what the patient said, I narrowed my differential down to this. That will make you look like a rock star, because what do most non-pre-prepared third-year medical students do? They just say, you know, one, they may not get the text because they're the student that's lost who didn't get the connections or text messages or numbers of their residents. So that student could be lost, and the residents, might not even be able to find the third-year medical student. Or if they were smart enough to do that, they get the text and they just walk down there and say, okay, what's going on? They don't have a focused mind. Your strategy is the key. You already have the contact information of the residents. You're going to look up the differential with your pocket reference or your book. You're walking down there, you're focusing your mind. You're kind of getting organized on the thought. You see the patient, you narrow down your differential, and you look like a rock star. So you're going to do great. Now, let's go through another scenario of you preparing to see a patient with adequate time to prepare. So let's say you have time to review the patient's chart on the computer or in the physical chart before you get to see them. Then you get to do a similar process that we did for the prior scenario, but in a more detailed format. So the first thing I want you to do is you're going to hear, okay, so it's a whatever age, male or female, and chief complaint, because you're going to get those 3 pieces of information from your resident. I want you to first mentally think of what the differential diagnosis could be. This is a great building exercise. You need to be able to do this over time without the aid of your smartphone or pocket reference and just have differentials in your mind. Once you've done that, then pull out your smartphone or pocket reference and start looking up the differential diagnosis for the chief complaint of that patient. And if you're good enough, you'll be able to form a differential in your mind beforehand, and then looking it up in your pocket reference is really a learning exercise to grow your differential, and that's a way of learning for you to grow your knowledge base and also test yourself and give yourself growth in your thinking patterns. Then what I want you to do after you kind of have a basic understanding of, well, what could be going on, read about the patient in the chart. Look at the note written by the ED doctor. Look at the vitals. Look at any available labs or imaging or whatever that may have been ordered. Take all this information that you have and then try to narrow your differential diagnosis and focus your thinking. Then think about specific questions that you want to ask the patient to help narrow your differential diagnosis. This is what makes a really star doctor and also an amazing third-year medical student. When you're asking specific questions regarding a problem, what we know is, man, that third-year student's doing great. They're asking those key questions. They know what's going on. That's going to blow your team out of water. So if you have the chief complaint, you have a differential diagnosis, you have all the information from the emergency room physician, you kind of have an idea of what's going on. And then you can say, you know what, if I ask these following questions, I can narrow down my differential even more. Then you look fantastic. What I also want you to do to look even more like a rock star is think about specific portions of the physical exam that you want to perform to help narrow your differential diagnosis. If it's a patient with abdominal pain, think about specific maneuvers per appendicitis. Think about imaging you may want to order. Think about specific parts you may want to listen to or touch. Have these in your mind so that when you go see the patient, not only will the third-year student be a rock star for asking specific questions, they'll be even more amazing for performing specific techniques. You will look much higher than your level. Now let's go even more amazing. Start thinking about specific labs, tests, or imaging modalities that you may want to order to help narrow down your differential diagnosis. Could be ultrasound, could be CT, could be lab work, could be urine work, whatever. The more of these things you have prepared in your mind, you're going to be a little bit dynamic in the room. You're going to be hearing about complaints, it'll narrow your diagnosis, and then from that you'll say, you know what, I want to do this physical exam technique, and I want to order those labs, and hopefully they'll come up to a solution as to what's going on with the patient. If you can do that as a third-year student, you are going to be a super, super rock star. Now really, the way that you have the entire note essentially given to you by the ED attending is essentially what you're doing in your head before you go see the patient. When you start thinking about the patient's age, their sex, and their chief complaint, from this you build a differential diagnosis and then you narrow it based on the information that was given to you in the computer. What I want you to start doing here is start thinking about the parts of the patient in the SOAP format. We talked about this in the prior lecture, the subjective, objective, and assessment and plan format, and think about specific information you will need for each of these sections to help you come up to the most likely diagnosis. Now, let's think about that. The subjective is what the patient's going to give you. So when you go down there, you're going to be saying to yourself, okay, I want to ask specific questions to pull from the patient to put in the subjective. In the objective, I want to add or order specific labs or imaging to put in the objective to give me more information to kind of pull. And then in the assessment, you'll be able to take all the questions that you wanted to ask, the physical exam maneuvers that you wanted to perform, the laboratory and imaging values that you wanted to order under objective, and then come up with an assessment from your narrow differential diagnosis, and then you can come up with a plan. So really, if you always think about that SOAP format in your mind, you can also think about how you want to work up the patient. What questions do I want to ask? What exam do I want to do in the physical exam? What kind of objective things do I want to order? And then take all that and put it in your assessment and plan. Let's summarize what we've talked about. So you should always be available for your team to take on a new patient. This is the major workload for any medical team, accepting and admitting new patients. So you should always be available to help with your team and help get the work done. Then you look like an asset as a third-year student. Whenever you're going to go see a new patient, get 3 vital pieces of information: the age of the patient, the sex, and the chief complaint. Get this from your resident when they're telling you about the patient. These 3 pieces of information are absolutely vital to guiding your information and also your thinking. Don't be worried or nervous about asking the resident. They understand. They need to give you those few pieces of information. And if you ask, they're going to be mildly impressed to say, you know what, this guy's getting it. He's asking the right questions. And depending on how much time you have, a little or enough, prepare and compose a differential diagnosis for the patient and come up with as much as a plan as you can before seeing the patient. And think to yourself, what questions do I want to ask? What physical exam techniques should I perform? What imaging or lab values do I want to order that'll help me narrow down the differential diagnosis for the patient and come to a clear assessment? Thank you.